I think it's really interesting the point that you raised because, I know that Memorial certainly has a very strong clinical genetics group that's available for counseling. And, in other places of the country where that may not be so readily available, I think remote access is probably the wave of the future. But how do we, for the practicing clinician, let's say that's in the community, and does not have access within their institution or hospital to a clinical genetics team. Can you map out for us what the testing paradigm would look like? Are you doing extended testing for everyone? Are you starting off with a risk-based stratification? And then at what point do you involve your clinical genetics counselors, particularly, let's take off your clinical genetics expertise for a moment. Can you walk us through what that testing paradigm might look like out in the community?
I think we're already experiencing what happens out in the community, which is people, a high proportion of people who are coming to us, as a tertiary center, who are having their diagnoses made outside. At least the higher risk patients, the younger patients, have already had their testing sent before they even arrive.